It's a distinct pleasure and honor to introduce our next speaker, Senator Todd Young of Indiana. He's a fifth-generation Hoosier. He is a graduate of the Naval Academy and served in our military for 10 years. Before coming to Capitol Hill as an elected official, he served on the staff as a legislative assistant for longtime Senator Richard Lugar from Indiana. He eventually returned home to practice law and then got into politics, was first elected to the House of Representatives in 2010. 6 years later, he ran for and won the Senate seat from the state of Indiana. He sits on the influential HELP committee in the Senate, which has jurisdiction over many of the health care issues that are so important to us. Senator Young is fast becoming one of the key leaders in the Senate on health care reform and debates around health care, and has as a goal to develop bipartisan solutions that assure Americans affordable, quality care. I am sure he will be able to give us some insights into the latest deliberations on health care policy. So let's welcome to the stage Senator Todd Young from Indiana.
Well, good afternoon. Thank you for that generous introduction. Great to see so many, I was going to say so many familiar faces. I can't see a darn person out there with these Klieg lights, but I know that, there we go. I know there are a lot of familiar friends out there because I have visited with this group before, and I appreciate your counsel and the good work you do. We both serve the same constituencies in many respects, so thank you so much on your efforts to improve healthcare access and healthcare outcomes in the communities you serve, and for ensuring that we get it right up on Capitol Hill and in this town. You, I know, are on the front lines of ensuring that we tackle our nation's greatest healthcare challenges. So it's policymakers like myself who depend on your counsel extensively. And the issue I think most frequently about, in terms of requiring that counsel these days, won't surprise you. It's our opioid crisis. It's destroying lives and really decimating entire communities across this country. And I am told that we can expect the situation to get somewhat worse before it gets better, but I remain optimistic because there are people like you that are marinating in trying to improve the lives of the most vulnerable, the most at-risk Americans on a daily basis, and in helping me and folks like me address it. Indiana has seen this crisis firsthand. In fact, before I was a U.S. Senator, I've been in office about a year now, I was a member of the House of Representatives. And I represented a congressional district that runs from just south of Indianapolis down to the Ohio River. It's a fairly narrow strip of real estate, but it covers a county by the name of Scott County. And within Scott County, Indiana, is a little town called Austin, Indiana. I see a couple of affirmative nods here in the first couple of rows. Austin, Indiana has caught national attention because Austin was the scene of a massive HIV and tuberculosis outbreak on account of intravenous drug use, all related to the opioid crisis. So this crisis has hit particular communities very hard. I've seen the toll it can do on families, on young children who lose their parents, and an overloaded foster care system. And working together, we're just going to have to address this. I know our hospitals have seen the effects of this crisis. You've, in fact, have had a front row seat with respect to the terrible effects of this epidemic. Our emergency rooms are at capacity. Our first responders are overwhelmed. But again, by working together, I still have faith and a deep conviction that we can help improve treatment options and save lives ultimately. I recently spent a week in the state of Indiana traveling around. I began that week in Indianapolis, and I held a roundtable conversation. It was one of these broad-based community conversations where we had not-for-profit representatives and people who serve the homeless. We had local law enforcement, and we also had some representatives from our local hospitals there. I launched my Fair Shot agenda. The objective here is to ensure that every Hoosier has access to their own version of success. Our Fair Shot agenda has 4 key pillars, 4 areas of emphasis: opportunity, safety, better government, and health. And to launch this initiative, it was important that we had our physicians and members of our hospitals there. They offered valuable insight into the treatment and prevention programs at hospitals across my own state. A major component of this Fair Shot agenda is making sure that everyone has a fair shot to live a healthy and productive life and not have to go to extraordinary lengths to do so. Whether by overcoming addiction or gaining access to needed medical treatment, we have to make sure that patients have the resources that they need to overcome addiction. I'm committed, as I know so many other members of Congress are, to ensuring we do our part to make sure that those resources, those essential resources, are available to every American. That's why I introduced one piece of legislation, bipartisan in nature, called the Opioid Addiction Risk Transparency Act. The President recently signed this into law as part of the FDA Reauthorization Act of 2017. The legislation offers doctors better information about the risk of addiction and encourages them to communicate that information with their patients. We also took needed action collectively in Congress, working with the administration, with the Comprehensive Addiction and Recovery Act. I know all of you are familiar with that piece of legislation. But a lot more work remains to be done. In some areas, we know what the right answers are. We just need to scale up those interventions, those approaches that we know are working. In other areas, that knowledge base needs to be more broadly disseminated so folks in Indiana understand what's working in other geographies. And we need to continue to experiment in those areas where information gaps and treatment gaps exist. I'm working with a bipartisan group of senators to increase health care price and information transparency. Our goal there is to empower patients, of course. We need to improve the quality of health care, and we need to lower health care costs, all done through health care price and information transparency. When folks have the information to shop around, we will see increased value for patients. And as a member of the HELP Committee, Health, Education, Labor, and Pensions Committee in the Senate, I have jurisdiction over much of the healthcare sector, and there will be more good work to be done, again, working with all of you. So with Chairman Alexander's leadership and the rest of the committee on the Senate side, and then folks like Peter Roscom, who I enjoyed working with as a member of the Ways and Means Committee on the House side, I'm really convinced that we can help stabilize the individual market. We can come up with unique and even better ways to address the opioid epidemic, and we can find ways to reduce the cost of prescription drugs. I look forward to continuing our work together, and your input every step of the way will be essential to that end. We have to provide long-term stability to our healthcare system and give each and every American the opportunity to access quality and affordable care. That is both your objective and mine, and that is part of making sure that every American has a fair shot to succeed. So I look forward to staying in touch. Thank you for this few minutes of your valuable time, and God bless.
Thank you, Senator. That was great.